As I mentioned, this patient had a high FLIPI score, or a Follicular Lymphoma International Prognostic Index score. And there are two FLIPI scores. There's a FLIPI 1 and a FLIPI 2. FLIPI 2 is essentially the results and prognostic information that we need to know about a follicular lymphoma patient in the era of the use of rituximab. FLIPI 1 or 2 are both important to know and both important to use, and they're important to prognosticate for patients, to really put them into different risk groups so that we all understand, including the patient, their risk for progression and their risk for needing additional treatment by a certain amount of time. So the Follicular Lymphoma International Prognostic Index scores 1 and 2 are a little bit different. The parameters are a little bit different, and it's actually not necessary to memorize them and to know the different factors and how to calculate a score, because you can just go to the internet and type in the Follicular Lymphoma International Prognostic Index, or FLIPI, F-L-I-P-I, and you'll get a calculator, and you can put in there the age of the patient, their beta-2 microglobulin, how big the mass of their disease is, if they have bulky disease or not. You can put in their LDH or their hemoglobin, and it'll give you a score and put you into different risk groups so that you can know for prognostic information how the patient's going to do. But that's really for the time of diagnosis. We really don't use that as at the time of relapse for most patients. One of the things, of course, that we do in patients, and this was done in this case, at the time of diagnosis, this patient didn't need treatment. And watch and wait, as we like to say, watchful waiting, was very appropriate. We don't treat patients still in this day and age with follicular lymphoma unless we have a reason to. Why is that? Because we've never had anything that's shown that if we treat someone at the time of presentation, if they're asymptomatic without a need for treatment, that we're going to make them live any longer. So if we give people treatment when they're asymptomatic and don't need anything, we're only going to perhaps make them feel worse. So we don't do anything. Watchful waiting is perfectly appropriate and reasonable for patients. How do we know, though, when we need to treat someone with follicular lymphoma? And fortunately, we do have some criteria that are very well defined that help us make that decision. They're called the GELF criteria, or GELF, and they come from a French study that looked at the parameters that really drove the need for treatment. And there are a variety of them. Again, you can go to the internet and find these easily, but they're simple. They're things like more than 3 centimeter disease in at least 3 sites. They're bulky disease, they're symptoms, they're symptomatic splenomegaly. You get the idea. GELF criteria are really what should drive if someone needs a treatment or not.